Good afternoon. Stan Bergman here from Schein at the American Dental Association meeting in Atlanta. And we are with this afternoon Kell, who is the president of the FDI, the International Dental Federation. And the goal is to have our viewers understand what the FDI does and how industry relates to the FDI and how we together achieve a common goal. So, Kathy, it's good to be here with you.
Thanks, Stan.
Perhaps you can give us a view of what the FDI does, and then you as the newly elected president, give us a view of what your goals are.
Well, the FDI is an organization representing 1 million dentists worldwide. And we represent also 200 organizations. We're made up of organizations and 130 member countries. So really we're a federation of everyone who's involved in oral health care coming together. And our vision is leading the world to optimal oral health. So that's what we wish to accomplish over these next years. We just had a strategic plan with our General Assembly, which will guide us through the next 3 years, and we're concentrating on membership, advocacy, and knowledge transfer.
So I think one of the challenges that dentistry faces today, if not the biggest, is to have the public understand the importance of oral care. That it's not simply about cosmetics, and it's not simply about dealing with pain at a particular point, but it's really about the overall connection between oral care and good health care. And the goal is, I think, for us in the profession and in the industry to figure out ways to get the public to understand the importance of funding oral care. Perhaps you can give some thoughts to that.
Well, as president of FDI, I think my number one position now is to be an advocate for good oral health care.
Right.
And the FDI, too, advocates with the United Nations, through the World Health Organization, through the NCD, the Non-Communicable Disease Alliances, and through UNEP, through other UN agencies, and also through our member organizations. So we work together with them. And the importance of oral health care, one of the things we want to do for advocacy is make sure that we include oral health care in all policies, in all health care agendas that are going to be coming out through these agencies.
That's very, very important. So you have been involved with organized dentistry for a long time. I admire the work that you do. I remember working with you on the Future of Dentistry Committee in the early 2000s, maybe it was the beginning of 2000. And I admire the amount of time you put into this. And what I'd like to ask you is a question on patience. Because in a business, of course, you can go to people and say, you're employed, this is what we'd like you to do. Even at the ADA, you have staff members and you can tell them what you want to do because they're employed. But when you're involved in a not-for-profit, an NGO, trade association or professional association like the ADA, it's not possible to go to tell volunteers what to do, and in particular at the FDI. And there are many in the world that say, the United Nations is broken and therefore I want nothing to do with them. And there are some that say the United Nations is broken, but I'm going to make a difference. And if we can mobilize a lot of people to make a difference, we can make a difference. What is your suggestion to people that really see problems in organized dentistry and organized any other professional organization in the United Nations, in government, and they say, you know what, I just don't want to be bothered, no one listens, or there are others that just get involved like yourself and try to make it better?
Well, you have to have a purpose. You have to know what your purpose is, and you have to know what your business is all about. And even though it's a non-profit organization, it still has to be run as a good organization would be run anywhere. So you have to get people to rally around a cause. And as I said, our vision is leading the world to optimal oral health, which it's a big, broad vision. So we have to narrow some things down. And to be able to get our members involved, I just was at several meetings. In the last month, I've been in 4 different continents and 4 different countries, and what I need to do is listen. And I think if people know you're listening to them and care about what they're doing, they're going to be more apt to want to follow and continue on and to make sure oral health care it has the position that it should be in the world. One of the things that I listened to in the last several weeks, which happened in all these countries, is there's a big worry now about displaced persons.
Yes.
And I noticed even that at our meeting a few weeks ago that we attended, that there was an award for people that were working with people that are displaced. And so that's something I think we need to concentrate for awareness in the next few years. And we talk a lot about helping people in other countries, helping people within our own country in the United States. And I've noticed with Give Kids a Smile programs and Missions of Mercy programs here, that really can rally volunteers to a cause. So we need to have purpose, we need to have actual programs in order to get people interested.
Wow, that's so uplifting, because one of the biggest challenges in the year 2017 is the official data is that there are 65 million refugees, the largest number since the Second World War. I think it's significantly more. That's the number that are registered. And so many people see things on TV and want to make a difference. It's hard. Well, we did get an email last week from a dentist in Buffalo who had taken a group of his colleagues to Jordan to work in a refugee camp, and is making a tremendous difference. And it's really great to see that organized dentistries, and particularly the FDI, is even thinking about these things.
And one of the things we can do is to show that there is awareness of these issues out there, and see how people can communicate with each other. For instance, the issue that, or the project that you're talking about, if they know how to communicate with someone else, they can learn maybe how to have better equipment, better technology that's transferable, that they can take with them. So I think being able to link these groups together can be very effective.
So in that regard, you really have multiple constituents. You have the developed world dentists who have one set of problems, and then you have the middle countries, then developing world countries. How do you make sure that you satisfy all your constituents?
Well,
I'm talking about in the FDI.
Yeah. Well, with the developed countries, they're very interested in standards and regulatory issues, and that's very, very important. How are we going to develop standards? Not only in technology, but which is very important, things need to interact with each other, but also in education, in research. What types of standards are going to be developed, and what types of products are we going to be putting out there? So that's where developed countries have their interest. In countries that are developing and becoming developed, what they're interested is knowledge. They want to know what are the latest techniques, how can they serve their patients better, because they're getting products now, and they're getting things in their offices that they can use, and they want to know the best techniques and how to use them. And then again, what we talked about in the developing world, how can we play a part to make sure that the populations are being served? So we kind of have a three-tiered approach with our members.
Well, I'm glad to see you have a view for each of your big groups of constituents. Now, us in industry are very, very interested in helping the profession, because at the end of the day, if the profession again is successful, we will be successful. But also if we can align our cause, the profession wanting to help the world, industry wanting to help the world. What is your view on this? Because there are some in dentistry that say, not so much in dentistry, but I would say in the medical profession, that say industry has its role and we should not work together. We should buy the products and that's it.
Well, I think industry and mainstream medicine and oral care are becoming closer, because we cannot work without technology. Right now, we need to know how the products work. We need to have a better relationship than we've ever had in the past. And we see this when we go around. The products are specific, and you need to know how to use them. All the CAD/CAM products that are coming out now, the new 3D radiography, it's exciting. It's an exciting time to be involved in dentistry.
Firstly, I think it's an exciting time to be alive,
Yes.
because of technology and the impact of technology. I was speaking to somebody earlier on. I think the millennials are going to be the greatest generation ever, because they will know more about how to use technology than any other previous generation, and they will understand exactly how to use all these new ideas and thoughts. What are your views on the profession? Where is the profession heading?
Well, the profession's only going to get better. We're going to need more and more dentists becoming involved in medicine too. Because when we see the trends, a dentist isn't just going to be sitting in their office doing restorations. What they're going to be is involved with the total health care of the
Fantastic.
person. They're going to be involved more with diabetes, with heart problems, on and on, and looking at the overall health of people. More people visit their dentists than they do their private practitioners in healthcare.
So I'm glad to hear you say that, because at the end of the day, where the dentist begins and ends, where the physician begins and ends, is not as important as working together for the total health of the patient. Are you optimistic about that?
Oh yeah, I find myself even in my own office, I'm speaking to physicians more and more. We're communicating
Excellent.
more between, because we have the same patients and we need to know what's going on.
So that's very exciting.
It's a great time to be involved in dentistry and oral health care.
Right. And you have time to practice with all your traveling?
Not as much as I used to, but certainly I was in my practice a couple of days last week, and I'll be there all next week. So I get a chance to see everyone, and I've really enjoyed it. I've worked with 5 or 6 generations of patients over the years, and certainly that's one of the benefits of being a dentist.
Do you have a partner?
Yes, I do. So I have people in my office that are there and very trustworthy, and very happy to have them there to take.
I admire them because they're supporting this very important work that you're doing. It's I admire anyone involved in organized dentistry, because you could do a lot of other things other than spending that time. But in particular, I think it's a critical time at the FDI, because some plans have been laid. Specifically, when you were the treasurer, you made sure that the FDI was financially sound, and now I think it's a springboard to advance the big goals with you as the leader.
Yeah, it's not only a good time for dentistry, it's a great time for FDI too.
Yes.
We're in a great position and want to continue to do the good works that we've been doing.
So thank you, Kathy, for being with us. Of course, we wish you and the FDI all the best. You know you can count on industry. We're an email away. Just call us, tell us your plans. I know we work well industry today with the leadership, yourself, the incoming president, or the president-elect, and your foundation. So we look forward to that. You call us with your needs, we'll be there, and we'll partner together to help the world end up with better oral care, so we have better health care, and in the end, a reduction in the cost of the NCDs.
It's a great partnership, and we couldn't do it without you.
Thank you, Kathy. Thanks. And have a good rest of the ADA meeting, but more important, safe travels as you go around the world.
Thank you.
Thanks. Thank you. Thanks.